So like I mentioned, Justin is unable to be here with us today, but I think there is a pre-recorded presentation for us.
Hi everyone, my name is Justin, as introduced before. Sorry I'm not able to make it in person to Rendez-vous, but I'd like to take this chance to say thank you for allowing me a chance to speak at Rendez-vous. This talk is about my journey using ART and how this technology may be utilized in the bleeding disorders community. So a few things that I will be going over in my talk today will be my patient experience and my journey using ART. I'll have a brief introduction on fertility treatments. I'll discuss how fertility treatments may look in the bleeding disorders community. And finally, I will touch a little bit about how these technologies may be used in family planning. So I myself have hemophilia A, but funny enough, this was not the reason my partner and I went through ART. My wife has a medical condition that makes carrying a baby very high risk to both mother and child, with a very high risk of the baby developing birth defects. So, needless to say, a pregnancy was not recommended. My wife let me know very early on, and I, being an embryologist, said that, it's not a problem. We can just make embryos and find a gestational carrier. Well, it sounds much easier than it actually is, but I didn't want to scare her and diminish her hope of starting a family. We did end up making embryos. This was the easy part. We did find a gestational carrier. This was the hard part. We had a transfer, and very luckily, we had a beautiful boy. Next, I'm going to go over a few of the fertility procedures that are offered at clinics. The first is an IUI, or an intrauterine insemination. Next is IVF, or in vitro fertilization. We have ICSI, or intracytoplasmic sperm injection. And finally, egg freeze. Egg freeze is more of a fertility preservation method than a fertility procedure, but we'll go a little bit more into all of these in the following slides. IUI is the least invasive of the fertility treatments. Normally, a lot of sperm will be prevented from entering the uterus as the sperm moves through the reproductive tract. IUI helps concentrate the sperm and get as many sperm as possible through the cervix and into the uterus. This process involves collecting a sperm sample, washing the sperm sample, and finally inseminating the sperm into the uterine cavity using a catheter. In vitro fertilization, or standard IVF, is more invasive for the woman. The process starts off similarly with a sperm collection and a wash of the sperm sample. The difference is that instead of placing the sperm in the uterus, we collect the eggs, or oocytes, by taking them out of the body. This is achieved by retrieving the oocytes through the vaginal wall. This is where the invasiveness comes in for the woman, as it is a long needle that goes through the vaginal wall and picks up the eggs in the ovaries. The eggs and sperm are then put together in a dish where hopefully fertilization occurs and the embryos have a chance to grow to last. ICSI, or intracytoplasmic sperm injection, is very similar to IVF, with only a small difference in the fertilization process. We collect sperm and wash sperm once again, retrieve the eggs through the vaginal wall, but now, instead of putting the sperm and the eggs in a dish, sperm is selected under a microscope and one sperm is injected into one egg. After the sperm and egg are put together, we hope for fertilization. This is depicted by the embryo in the top left. As you can see, it is still at one cell, but we can see some fertilization in this embryo. Over the next 5 to 7 days, the embryo will grow and divide and hopefully make it to a blastocyst. That is depicted in the bottom right image. Once a blastocyst is formed, we can either transfer, test via biopsy, or freeze the embryo for later use. To test, we would take a few cells from the blastocyst to send for genetic testing, while the embryo is frozen, waiting to be transferred at a later time. The biopsies from the embryos are used in pre-implantation genetic testing. or PGT. There are three designations of testing. PGTA, or aneuploidy, is a basic chromosome balance test. This tests the embryo for the 23 pairs of chromosomes for a total of 46. PGTA can test for gender. However, in Canada, we cannot select embryos based on gender unless there is a medical reason to do so, i.e. a sex-linked disorder. The next set of tests is the PGTM, or monogenetic. These are single gene disorders, and hemophilia and von Willebrand's would fall under this category. Probes are made using parental DNA to test against the embryo. For my journey, we did not use PGTM and only did PGTA to test for euploidy. I already knew that male embryos would be unaffected and any female embryo would be a carrier. Even with this knowledge, we did not select based on gender, we just happened to have a boy. The final designation is PGT-SR, and this is for structural rearrangements. This is when there are chromosome inversions and translocations. Once again, the probes are created using parental DNA. So how does having a bleeding disorder affect the use of fertility treatments? Well, for a male, it doesn't really. As we have seen, the male produces sperm sample, and that's about it. A female with a bleeding disorder, however, would have some considerations. For all the treatments, there can be utilization of hormones via multiple injections for priming. There's also the very invasive procedure of egg retrieval. After an egg retrieval, all the follicles that the eggs were retrieved from in the ovaries can fill up with blood. This leads to bloating, and if not controlled, can lead to more severe health consequences. The best thing to do would be to discuss with the Hemophilia Treatment Center to create a treatment plan. How does assisted reproductive technologies help with family planning in the bleeding disorders community? To start off, we can create embryos, do genetic testing, and determine if the embryos are first normal or if they have a genetic disorder. This then leads us to its choice of, do we do a selective embryo transfer? So in situations like myself with a sex-linked disease, I may decide to do PGTA and do a gender selection to avoid passing on the hemophilia. For autosomal, like von Willebrand's disease, they may choose to do PGTM and select for the unaffected embryos. In either case, having the embryos available before pregnancy allows for a more in-depth conversation with the genetic counselor or even the HTC in planning for the pregnancy. Of course, the topic of embryo selection could be a whole topic in and of itself. Other uses of ART can be used to help prevent the transmission of STDs originating from the male through sperm washing. This is historically, I believe, how some patients with hemophilia have used ART, more so than for the genetic testing component. I've really only gone over the process of fertility treatments, but I wanted to quickly go over some of the numbers of a typical IVF treatment. So you can expect anywhere between 10 and 15 eggs retrieved. From those eggs that are retrieved, you have a 70 to 80% fertilization rate. Once the embryos have been fertilized, the chances of them making it to a blast is about 50 to 60%. And a blast, being normal after genetic testing, is about 50%. What that would mean is if you had about 10 eggs retrieved, you might get 3 to 4 blasts, and after the genetic testing, you might have 1 or 2 normal embryos. Of course, these are numbers and statistics based on a large number of patients, so each and every individual may have higher or lower numbers. Just wanted to include that just to kind of show that even though we can make normal embryos, we do have to be realistic with the number of eggs that we start off with. this brings me to the end of my presentation. Thank you for letting me share my journey and give a very, very brief overview of some of the fertility treatments that are out there and how they may be utilized in the bleeding disorders community. Of course, there's a lot of things I did not go into, and that might be something we decide to discuss at a further rendezvous. Once again, thank you very much, and goodbye.